My name is Chris Purdy. I work for ARM Incorporated. We're located right here in Buffalo at the Center of Excellence. My job title is a statistician, and that's the kind of work I do, being involved in study design and analysis of studies and analysis of data sets. So I grew up on a farm, and I thought, well, maybe I'd want to go to medical school. So when I went to college, I went for biology. While I was in college, I found out I liked math a lot, so I took a lot of math courses. When I got done with college, I decided to go back and work on our farm for a while. Then I decided, well, our farm was small and it wasn't really something I could make a career out of. So I decided that I had some friends that were machinists. I had one that owned a machine shop, so I thought that was something that, even though it really didn't go with my previous training, that I wanted to do. So I actually went back to school for that for a little while, and I worked in a couple different machine shops for a few years, and actually I really enjoyed it. It was a pretty enjoyable experience. And then I decided I really wanted to go back for math. It hadn't really been my primary focus when I was in college, so I went back to the University of Buffalo and I got my master's degree in math and then in statistics as well. And so that was sort of how I got my training. While I was getting my training, I had an internship at ECMC. There's a Family Medicine Research Institute, and I got some good practical experience there. And then after I was done with my training and I graduated, I got the job here. I guess here's a kind of a description of some of the things we do, like pharmacoeconomics. So that's sort of the health economic stuff that I spend some of my time doing. Biostatistics, so that's another thing that I spend some of my time doing. And then the CRO services is what a lot of people spend their time doing. So that would correspond to like the data management, and then the folks that have to go visit the hospitals and review the data as it comes in on a patient to make sure that everything's been collected, and that that takes up a lot of people's sort of time and energy. A typical day is probably a little bit hard to describe because there's really a lot of variety in the work I do. So, really it is dictated by the type of project that we're in. And so some of the projects would be considered clinical trials, some of them would be considered like observational health economics trials, where they want to be concerned about the safety and what things cost. A clinical trial is pretty much concerned with whether it works. And I'm also involved in projects where we just take data that's already published and we summarize it. So the actual activity really varies a lot depending on the project. Sometimes it's meetings, sometimes it's sitting here and programming. The best part of my job is the variety of the work and the challenge. I'm involved in a lot of different projects, and a lot of them are challenging in terms of communication as well as technically. The other part that I really like about the job is all the different people I get to interact with that are involved in these projects from different perspectives. As far as my advice to somebody, I think that the advice that I would tend to give somebody is to really think about what you like to do. I mean, what are the things you really enjoy doing, and then see what kind of jobs sort of match up with the things you enjoy doing. And then if you can get some experience, I mean, because I think it's tough for young people, and there's so many options. There's so many things that they've never even thought about. You know, you think about being a doctor, you think about being a lawyer, because those are the kind of things you see and you can kind of readily kind of think about, you know. But there's so many other jobs that you probably don't even know are even out there. So I guess if you can get some exposure and think about, your talents and what you really like to do.